Good morning, everybody. My name is Scotti. I am an eye doctor, and I deal basically with retina. I work at Istituto Auxologico Italiano. Today we speak about retinopathy and RetinaLyze, a detail that will be dealt with later by my colleague. Retinography is a diagnostic examination that allows us to analyze the retina. The retina is the only part of the body whereby you can see the cardiovascular nervous system without cutting. You simply need to dilate the pupil and the retina can be seen completely. We have various ways to see the retina, various diagnostic techniques, amongst which retinography. And first advantage, it doesn't necessarily have to be performed by an eye doctor. It can be performed by technicians. It's not harmful. You do not use dye. You do not use filters. It can be repeated, and it's very good to follow in the course of time the patient. And clearly, to perform good retinography, you need to know what you are considering. This is normal retina, and this is not the right venue to give you details about retinography. When you consider the fundus of the eye, you should consider the optical nerve, that is to say, that wide area, wide sphere that you see here, the vascular tree. Here you can see the arteries and the veins, and the caliber reflex crossings, and the macular region in the bottom part on the right, which is extremely important for a set of diseases that we shall consider later. And the periphery. I don't have pictures of the periphery here. This is normal retina. In the top part, you have normal retina of a young person without retina-related problems, and in the central part, you have myelinic fibers and drusen of the optical nerve. In case you identify complex situations, you can refer the patient to most adequate venues. This is a slide showing you nearsightedness, normal retina, when nearsightedness is not so severe, to then get to atrophic pigmentary alterations. And today we shall speak about two recurrent diseases in the population, diabetic retinopathy and macular degeneration, and diseases that can be analyzed by RetinaLyze. I'd like to give the floor to my colleague Josè. Yes, good morning. My name is Dr. Vallejo, and I work at Istituto Clinico Humanitas. And for some time now, we have been strongly believing in screening, and first access of the patient should be efficient, should be easy, and screening is performed for frequent problems. And amongst such problems, you have diabetic retinopathy. In Italy, 2 million patients, that is to say 4% of the population suffers from diabetes. That's just the beginning. And this percentage will increase because of longevity and eating habits, and it's the first cause of blindness in the working population. Young people losing their sight, and that's how a patient sees with macular edema. It's a diabetic problem. We know that diabetic retinopathy is microangiopathy in the retina, and permeability of the vessels changes, and it is classified in proliferative, non-proliferative, and various degrees. And macular edema, macula is the area with which we see 10 tenths and the fovea is highly affected in this disease. Here, I'm sorry, you can see well. You first sign spots that can be hemorrhages or microaneurysms. Another sign of an evolved disease, hard exudates, accumulations of cholesterol. Cotton wool exudates, whitish exudates are infractions of surface nervous fibers. You have vascular anomalies and you have new vessels because of induced ischemia. You have anomalous vessels, mature vessels, and the last sign, bleeding. The vitreous should be transparent to allow for the entrance of the light. It is blurred by blood instead. And here you see hemorrhage, and the macula by itself doesn't seem to be so highly altered, and the picture by itself can be tricky. And it's not the only thing that we should duly consider, and then I will explain to you. Here you see retina detachment and the scary tissue of new vessels. It drags the retina, it is detached, and it needs to be operated. You can treat it with a laser, and the patient has low vision. Well, screening. Screening is the first approach. When a patient arrives with a frequent disease, and nowadays the evolution of technologies and drugs, well, a physician doesn't necessarily assess all patients. You have new programs that can contribute to the screening of patients. And in the case of diabetic retinopathy, the diabetic doctor should be aware, and also the eye doctor, optometrist, everybody contributes to managing the patient at best. If you have an IET program and a technician performs a test, then the physician visits the patient. If it's a physician performing this, it means that you prescribe a therapeutic plan, and also very severe forms, proliferative diabetic retinopathy that needs to be photocoagulated. The degree of retinopathy varies. Type 1 diabetic patients, macular edema has a later onset than other cases, and the patient should receive laser, aggressive laser, and the patient can see with 10 temps. And here you have a scheme on how to manage screening programs. Type 1 diabetic patients, the fundus of the eye, retinography, diagnosis, and then in the first 5 years, if everything is okay, well, you don't need to check such patients so often. When such patients have some signs of retinopathy, well, they can be followed up each year with hormonal development. Retinopathy changes, and it can be faster. When you have a risk for macular edema, you need to see the patient every 6 months or every year. And type 2 diabetic patients, insulin-resistant patients, patients of a certain age, it's almost impossible to lead them change their own lifestyle. They are followed more frequently, every 2 years if they have mild signs, and every year when mild signs have an impact on posterior pole, when they have retinopathy every 6 months and every year. Pregnant women, because of hormones, should be followed closely. A diabetic patient that becomes pregnant should be followed up every 3 months. And at the moment, I'd like to speak about another screening program, maculopathy, and I'd like to give the floor to Dr. Scotti. And Dr. Scotti goes on. Why age-related macular degeneration, and why screening for this disease? It's highly frequent. It is the main cause of blindness, legal blindness in subjects over 55 years of age. It's the third cause of blindness in the world if you screen all patients. And this disease is on the increase because average age is increasing. As my colleague said, you should try and, in a way, refer to physicians, patients that need therapy. There are two forms of it, an early onset form, dry form, and an evolved form, and it is divided into neovascular and geographic atrophy forms. In Italy, to give you an idea of statistics, it affects approximately 2% of the population, more than 1 million people. And it leads to a social problem. People are less self-sufficient, and in a way you need to follow them up well. And you have various risk factors. And I do not get into detail. You should. Eye-related factors are Drusen and patients with a history of AMD. Maculopathy leads to progressive decrease in vision and fixed central spot. The patient can't read, can't see near, so it's highly disabling. And you see, retinal signs of the initial form are Drusens, and we have various types of them. Those that are more prone to risk are so-called soft macular drusen. It's accumulation of lipidic material just below the retina, and they seem to be snowflakes. And then you have other types of drusen that are not so prone to evolve to a neovascular condition. And in black, you see areas that need to be followed up in the course of time in a darker color, because they may progress toward a neovascular condition, which is like this: formation of a vessel in the central part of the retina, which is non-vascular by definition, and it leads to conditions that you see in the picture, sudden decrease in vision, and it's irreversible despite therapy. Therapy doesn't improve visual acuity, and atrophic conditions where sight loss is a bit more gradual. In evolved neovascular forms, we have scar tissue that invades the posterior pole macular region. Such patients don't see so well, and they need visual rehabilitation. Why screening? Because it's a highly frequent disease. It's a disabling disease with cost-social benefit ratio which is quite high. By identifying risky patients and early lesions, you can have a population that is not so old. In the past, when you were 60 years of age, you were old, but now it's not so. And this population can keep on working and be self-sufficient. When to refer the patient? You refer the patient when you see certain retinal signs I've just shown you, and when they speak about symptoms, distorted vision, and when they report they don't see so well. That's it. This is it.
Allora, adesso il mio collega parlerà di RetinaLyze.
So now my colleague is going to talk about RetinaLyze.
Hello, my name is Ganesh Ram. I'm the Chief Commercial Officer and co-founder of RetinaLyze system. RetinaLyze is an automated algorithm for screening for diabetic retinopathy and macular degeneration. RetinaLyze makes it easier for you to perform RetinaLyze or retina image screenings by making it faster, much easier, and also cheaper to perform these screenings. It's an online software which screens automatically, and we cooperate with ophthalmologists to make sure that we verify each result that comes out of this algorithm. It gives results automatically within 30 seconds, and we also have seamless integration with Fundus cameras, so you don't have to transfer data manually. Just to show you what effect this system can actually have on your business, I want to show you some results that we've achieved in a Danish optometrist chain. We have seen a higher employee satisfaction, meaning that people who work in the chain, the opticians, are actually more happy about their job because they can provide a healthcare related service to their customers. We also see an above 30% increase in customers, new customers who are loyal, that come in the store and also buy glasses or contact lenses, which means more revenue for the optometrist. We've seen increased customer satisfaction because it's a more holistic way of providing a service to your customer, and it's also a much faster service when you're providing an eye exam. Just to show you why we need to do this, there are actually 40 million blind people in the world, and if we've made screening attempts like this, in a screening of the general public, we would have prevented about 80% of these. The primary reasons in the Western world are actually diabetic retinopathy and AMD, the primary reasons for this blindness. About 30% to 50% actually of diagnosed diabetics will get diabetic retinopathy within their lifetime, which means there's a lot of people who needs to be screened and a lot of people who needs to go for annual screenings somewhere. And the system, the primary healthcare system, can't actually uphold or fulfill this need because there's a explosive growth in the number of diabetics. Today there are 600 million people in the world who have diagnosed pre-diabetic, and 300 million people who are diagnosed diabetics. This will grow exponentially and linearly and double over the next 10 years actually. So we'll have 600 million people who are diagnosed diabetics and 1.2 billion people who need pre-diabetic healthcare. The problem is that today ophthalmologists normally handle this screening by having them come to their clinic, but we see a 100% growth over the next 10 years in diabetes cases and only a 1% increase in the number of ophthalmologists. So you can see both now and in the future there will not be enough ophthalmologists to handle these patients to screen for blindness. So there's a potential here. There's a potential for optical stores, optometrists like you, to enter healthcare and provide a more holistic service, to provide retinal screenings in your store. RetinaLyze is a way for you to engage in that easily, cheaply, and much faster than getting screening training. So what does it look like? As I told you, it's an online software, And basically, we have two areas of the system. One is where the newly uploaded images are, and another where the already analyzed images are. So we see the first one at the top. And we have the possibility of running the screenings here for diabetic retinopathy and AMD. And we can see the results down here in red, green, or yellow in 30 seconds. We also have the possibility to send this image to an ophthalmologist for verification. The system will also mark all the areas that have any lesions, for instance, microaneurysms or hemorrhages or Drusen. It will mark those areas so you can verify that there's actually a case of diabetic retinopathy. And you can send the entire image and all the patient's data to an ophthalmologist for verification to make sure that there's actually something wrong here, that it's not just a pixel error on the camera, for instance, or a reflex. So, the software makes it possible for you to screen for diabetic retinopathy and dry AMD, the early signs of these diseases. It will also give you a detailed view of the image, marking the areas that need attention. A statistics view to make sure that you know how many screenings that you've made, how many customers have you had through the store. And also it gives you the ability to print a report to the customer and give it to them in the hand so they can understand what they've been screened for and what the assessment is, and also a recommendation. Do they need to visit an ophthalmologist today, or can they wait 6 months, for instance? The results are presented in 3 different colors: green, yellow, and red. It makes it very easy for you to assess if there's something you need to do, or the customer can leave the store immediately. The green is what you will experience in most cases. About 95% of your customers will have no pathology on the retina. That means you can provide them with a fast service and have them buy some glasses and exit the store happily knowing that their eyes are healthy. Yellow is for instance, temporary bleedings. You can have that if you had a feverish disease. It can also be if you've been working in the garden too much or heavy work, for instance. They will usually go away after 2-3 months, so you will ask the customer to come back within 2 months. And red is where we found a lot of alterations on the retina, and we would like the customer to be assessed by an ophthalmologist locally. So this is the process that we use around the world. The software is actually being used in optician stores by optometrists, by ophthalmologists, and also at hospitals for general mass screening of the population. The process is that we have a pool of subjects, and we do the RetinaLyze screening here. If it's green or red, the result, we ask them to come back in a year or 6 months based on the result. If it's red, we have the result analyzed and verified by an eye specialist in Italy. That will be Dr. Scotti and Dr. Vallejo here, who will verify that there is something wrong, that there is a matter of pathology here, and also give a recommendation. How soon does the customer have to visit an ophthalmologist, for instance? And then the local ophthalmologist does the actual diagnosis and treatment. So let's move on to the business case. What can this do for your business? How can you earn money using this? I'll just talk briefly about the prices. This is a monthly subscription that you get access to a web-based system. So you pay a monthly subscription fee based on the amount of screenings that you make. Each screening will actually become less expensive. So let's say you do 200 screenings a month. You pay 120 euro as a fixed price, and you pay 0.60 per screening, meaning that the cost of each screening in that 200 euros is 0.60 euro. You get access to a help forum, you get access to guides, and we will also give you the necessary treatment to assess a retinal image and to take the images of the customer, and also to explain the customer the results and what they've been screened for. There are generally 2 ways to earn money in your stores with this system. One is charging the client a low fee per eye exam. So for instance, if you provide an eye exam today where you do a refraction and so on, You can also include this in the eye exam and add an extra fee for it, for instance 10 to 20 euros, and you'll earn that margin each time you do an eye exam. The other possibility is including it in the price of the eye exam that you have already. In both cases, you will actually earn money because this customer comes into the store, gets a service, and is attracted. 30% more, for instance, in Denmark in campaign periods, will come to your store and buy glasses and contact lenses. It's also a matter of differentiation. It's a matter of branding your store as a more professional chain or store. You can brand yourself as being more knowledgeable about retinal images or providing this more holistic service to your customers. If you don't have a Fundus camera today, you can actually earn return of investment on a new Fundus camera, for instance, a Canon CR2, which has autofocus. You can earn a return of investment in 16 months. The cost of a retinal camera is 15,000 euros, roughly. I'm sure you can get a discount if you buy it today. But if we assume that there are 325 working days and you take 6 screenings each day, or 6 clients each day, and get 10 euros per customer, you can actually make 19,500 euros in the course of these 16 months. You pay only around 4,500 for the subscription, 15,000 for the camera, which means you can have a profit after 16 months. So what are the advantages of using RetinaLyze compared to manual screening or telemedicine, for instance? Well, you can have very quick results. As I mentioned before, only 30 seconds, which means that you can have the customer come in and exit the store very quickly. This is powerful because you want to screen as many people as possible. You want to attract as many people and many new customers as possible to your store. It's very easily understandable results, meaning that you only need very little training as an ophthalmologist, as an optometrist, to use this software and to understand the results that the ophthalmologist gives you. We include any training that's necessary, and we also include the training in communication with your customers. It can be difficult to explain them what they've been screened for and the results, what the recommendation is. We'll give you training in that. It's a cheap solution per analysis because only 90% or only 10% of the images are actually sent to an ophthalmologist. 90% will be exiting the store without being sent to an ophthalmologist, and as you saw before, the price of each screening is very, very low. We can give you an increased revenue because you have new customers who are loyal, who come in and buy contact lenses and buy glasses. There's an increased client satisfaction because it's a more holistic service, something else that your competitors does not provide. And we have more loyal clients. We see that around the world, that people who have been made assured that their eyes are actually healthy or that they've actually found something, a pathology of some sort, and they've been recommended to visit an ophthalmologist and have been treated. These are loyal customers who like the service that you provide and will come back. Another advantage is that you actually convince the customer to come back in every year instead of every 4th year or 7th year if they wear contact lenses or glasses, which means a returning customer that you can upsell to each year. There's only a few required hardware here. You need a computer and you need a internet connection and a Fundus camera. And all this can be provided by our supplier here, Frostema. We will give you a login to each store, so you have one login, no passwords that goes missing or anything. It's a very user-friendly application. We'll give you the training necessary so you get a good start. If you are a representative of a chain, we can talk about it, but we can give you an implementation program and training course for all your employees. And there's also maintenance and support also available in Italian, local support here, a phone number and email that you can give. You can also get in contact with the 2 doctors if you need that. So just to show you that this actually works, we've compiled some results of a Danish optometrist store who have 150 stores in Denmark. These are results gathered over 6 months, the last 6 months actually. And the clients that walk in the store are general public, not diagnosed diabetics, just people walking down the street, seeing that there is a RetinaLyze screening available or retinal screening available, and walking in for an eye exam. Out of 190,000 screenings, we've found 1,200 cases of macular degeneration, 340 cases of diabetic retinopathy, and even cases of glaucoma, hemorrhages. Some of the most serious cases are tumors, either in the brain or in the eye. Thank you very much. Also cases of cataract or artery embolism, high blood pressure, and also retinal detachments, amochir retinae, which means that the clients there, our customers there, the stores have actually saved people from going blind within the next 3 days. This was with the help of RetinaLyze and the attached ophthalmologists. So you can actually earn some money, you can attract new loyal customers, and you can do something for the general public, you can do something for society, you can save sight, you can prevent blindness. So wrapping up, RetinaLyze has been recognized as a tool to regain, for opticians to regain their rightful place in the healthcare system. You can do a lot of impact, you can prevent blindness using this system. It's also known as a marketing tool to attract new customers to your store. Again, as I mentioned, above 30% more customers in marketing periods. There's a rise in store traffic, which increases the demand for glasses and contact lenses, of course. You can upsell to the new customers that come into the store. It also increases the revenue like that. And in total, it makes it much easier, cheaper, and faster to perform these retinal screenings. So you can improve your business, and you can help society, you can prevent blindness. Thank you very much. Please visit us at Podium 3, stand B17. Does anyone have any questions? We can answer them in Italian as well. Thank you.
Thank you. Bye.
Grazie a tutti per essere venuti.
Thank you very much for attending this session. If you have any questions, please do not hesitate to ask.